All right, today's hearing will examine ways we can work to improve healthcare price transparency. Healthcare affordability has long been a priority for this committee and congressional Republicans. Building on the foundation established by President Trump's transparency initiatives, we have focused on policies that increase competition, expand consumer choice, reduce regulatory burdens, and strengthen transparency throughout the healthcare system. While there is no single solution to addressing rising healthcare costs, empowering Americans with better information and transparency data remains a critical step toward a more efficient, accountable, and affordable healthcare landscape. For too long, patients, families, and employers have faced a health system where the cost of care is often unclear, sometimes even unclear after the care is delivered. As we have seen throughout our affordability series, healthcare pricing, medical bills, and coverage information can be complex and opaque. But it does not have to be that way. Greater transparency is essential to creating a more consumer-driven marketplace, where patients have the tools needed to make more informed care decisions. When patients have a better understanding of the costs associated with medical treatments, procedures, and services, they are better positioned to compare options, seek high-value care, and avoid unexpected medical bills. Increased transparency is also critical to bringing healthcare disruptors into the marketplace and promoting competition amongst insurers and providers, where we continue to see consolidation that contributes to higher healthcare costs. It is important that we strive to foster a health system that not only delivers high-quality care at a more affordable cost, but also increases accountability across the sector. This administration, both in President Trump's first term and this current term, has prioritized bringing more transparency to healthcare. Some of the proposals today build off the transparency work that President Trump has implemented through regulatory pathways, meaning a different administration can come in and change or reverse course on those pathways. That's why codification is so important, as it aims to allow for a more standardized format and implementation of rules for hospitals and insurers to follow. During this hearing, we'll explore a range of legislative proposals aimed at strengthening transparency requirements and providing patients with upfront, clear information about healthcare prices. One of the bills we will consider is an updated version of the Lower Cost, More Transparency Act, which was led by former Chairwoman Cathy McMorris Rodgers and passed the House on the floor back in 2023. The bill aims to increase price transparency throughout the healthcare system, including hospitals, ambulatory surgical centers, and clinical labs and imaging testing. Additionally, some of the proposals today look at ways we can empower the Centers for Medicare and Medicaid Services, or CMS, with the tools they need to improve price transparency data and accountability. Further, we look at ways participants can be more fully informed, as one of the discussion drafts requires a Medicare Advantage and commercial health plans to publicly post their prior authorization data so individuals can view the plan's approval and denial rates for health claims. Another bill we will discuss is H.R. 5582, the Patients Deserve Price Tags Act, championed by Representative John James from Michigan. This bill takes a slightly different approach compared to the Lower Cost, More Transparency Act, but shares the same goal of bringing more transparency into the marketplace. I am proud of this subcommittee's commitment toward working to lower healthcare costs for all Americans, and I am eager to examine these proposals so we can continue to look for ways to make healthcare more affordable and more transparent. I thank the witnesses for being here today, and I look forward to the discussion our committee will have. With that, I now yield back.